Thousands of people impacted by radioactive waste left behind during World War II are now applying for benefits. According to the Justice Department, since September, they have received 174 applications and 6 people have already been given their funds.
That's pretty incredible, but some 300,000 people actually might qualify for the Radiation Exposure Compensation Act, or RECA as we call it.
Now, people living in 21 zip codes near Coldwater Creek could be at high risk for cancer. Joining us this morning to discuss all of these matters and why cancer screenings are so important is the St. Louis County Health Department Director, Dr. Kanika Cunningham. Good morning to you.
Good morning. Good morning.
I was talking to you during the break about cancer clusters, and you gave me a number that was just kind of blew my mind. How big is the cancer cluster?
It's about over 80% of families impacted in North County, so multiple zip codes. Coldwater Creek is a long, stream of waterbed, I said river, running through North County. So all along that riverbed, communities are impacted. And when we look at the map of North County and the zip codes that we are considering to be a part of RECA, it's a significant portion of North County, unfortunately.
Wow, and we said 300,000 people could be eligible, correct?
Correct.
And only a few have applied and
Correct.
received funds already.
Correct.
So what is the county's and the health department's role in RECA?
Yeah, so our role is to educate about the current risk that still exists, the cancer risk. And so I think starting off, everyone was talking about compensation, how to get money. This is the first time that there's survivor benefits. But from a health perspective, I want people to know if you live in North County or even worked or attended school there, you are possibly at risk. This is a great time to talk to your primary care provider about what does that risk look like for me. I have an environmental risk factor. I've been exposed to radiation. What cancer screening options are available for me so that I can take care of myself and remain healthy?
When you think about this going all the way back to World War II, you're talking a lot of different age groups could be affected by this. Is there any particular types of cancers that you're seeing when you're doing the screening?
Yeah, so there's multiple cancers, and unfortunately, some of the cancers we don't have recommended screening guidelines for. So, for example, multiple myeloma, lymphoma, some of your renal cancers, there's not standard screening tests for that. But in North County, what we do see, we see more people being diagnosed with breast cancer, followed by lung cancer. And when we look at who's dying from those, we see more people dying from lung cancer, followed by breast cancer in North County. The other thing, depending on your zip code, there's on average about an 18% higher risk for you to develop one of those cancers that's associated to radiation exposure. So the risk is real, and we need to start talking about this.
Wow, it is so eye-opening and just mind-blowing, really. Does the county offer free cancer screenings? Like, what should people do? What is the first step if someone's watching today and they go, oh my gosh, I've kind of been in the dark about it. What do I do?
The first step would be obviously schedule an appointment with your provider. Have that conversation because everything is based on individual risk. Have that conversation. A good time to also think about other cancer screening options. For example, cervical cancer screening, just to make sure you're up to date on your preventive care screenings. That'll be step one. I think step two is we need to get the hospital systems and maybe our insurance payers on board to cover some of the screening options so we can provide mammograms and low-dose CT scans for lung cancer screening, but it still depends on, what the insurance will pay. So we're in a process now of trying to create opportunities to increase access to screening. But right now, I would say go to your primary care provider, come to the health department. We also offer sliding scale services for individuals who are uninsured. We can at least get you connected to a provider there.
Okay.
Doctor, thank you so much for joining us this morning.
Thank you.
Some very important numbers and very important to go out and get screened too.
And you're going to be sticking around in the 7 o'clock hour too,
Yes.
correct? Okay. Thank you so much.
Thank you again.